Heart attacks, strokes. It's not just COVID-19 that's killing people. And local doctors say they are seeing more people waiting too long to go to the ER for things like that because of fear involving coronavirus. They say it's leading to deaths that could have been prevented. Here's Betsy Webster.
An interventional cardiologist at Overland Park Regional is desperately trying to send a message after a man was rushed to the ER there. He'd had chest pains at home again and again, but didn't seek help until it was too late.
He didn't want to overtax the system, and he had a cardiac arrest at home. He was resuscitated by our wonderful EMT people, but his heart was destroyed by this huge heart attack he had.
He says doctors and surgeons did what they could, but 2 days later, that man died here at the hospital. Dr. Pearson says had the man come in earlier at the first sign of chest pains, he could have been saved. Then there's the stroke patient who also avoided the hospital when she had warning signs like numbness and tingling.
She was paralyzed on one side of her body because she had a stroke. We easily could have helped her with that, but she did not come to the hospital because she was afraid.
If you've got a health concern, COVID doesn't eliminate that.
An emergency doc at the KU Health System expressed similar concerns a little over a week ago. Whether it's heart attack, stroke, appendix, or gallbladder pain, the results can be disastrous if you wait. He says he's not sure if it's fear of infection that's keeping people away or a polite effort not to overwhelm ERs.
Well, that's all very much appreciated, but I would not, and I repeat, NOT, not want any individual in our community who feels like they have an emergency not to come to the emergency department.
Doctors at both hospitals point out they're not in a situation like New York. Their ERs haven't all been converted to COVID ICUs. They have the ER and surgery staff to handle other conditions. And they have setups to keep people with respiratory problems separate from those with other symptoms. This area at KU was an ambulance bay that they converted into a COVID screening area for anyone who comes in with respiratory symptoms, a completely separate entrance from the main emergency department. Overland Park Regional says it also has a system for separating patients.
It just breaks my heart to think that someone is suffering at home and having a life-threatening event that may lead to permanent disability that we could easily take care of, putting them at very little risk.
Betsy Webster, KCTV5 News.
We also spoke with Vibrant Health. They have health clinics across Wyandotte County. Their CEO tells us that they've had patients forced to put off routine office visits, often to manage chronic diseases. Their offices have started delivering supplies like blood pressure cuffs straight to their high-risk patients to try to keep them safe.